And okay, we'll just start. And I want you to kind of take the lead and say out loud what you're thinking. Now, on the real test, you're going to have to think it to yourself, or just kind of jot down little notes. But I want you to just kind of talk out loud so that I can kind of gauge what you're thinking. All right.
Okay. Um, what should the paramedic do? It's a two-step question. A 66-year-old patient has crushing chest pressure. Okay, so I would think more of a cardiac problem for him in general. His diaphoretic has nausea and weakness, so he's definitely sick and likely unstable. The diaphoresis is telling me he's kind of shocky. The 12 lead EKG or ECG shows ST elevation in 2-3 AVF, so we're looking at an inferior. BP is hypotensive, 82/48, and a pulse rate of 44. So the 44 is likely, if it is inferior, it is because the AV node and the SA node are probably like knocked out.
Mm-hmm.
It's involving the right atrium. Respiratory status, 20 minutes on the higher end of normal. And an SpO2 of 96. Lung sounds are clear. Patient took tadalafil, so that's a PDE5 yesterday. So no nitro.
And PDE5 inhibitor. Okay.
So no nitro.
Okay.
What should the paramedic do? So we're not going to delay transport. Withhold nitro, consider right ventricular involvement, and transport to PCI capable care. I would say that would be the answer.
And notice that's what you actually told me. You actually said no nitro. And this
Yeah.
question says withhold nitro. Your brain came up with the answer. That's probably the answer. Okay. We'll
Well,
just
for two reasons for that, because his blood pressure is hypotensive and because he took the PDE5 inhibitor. So he both reasons he can't have
Yep.
nitro.
And because there's an inferior infarct, we also want to consider, because most 85% of the time it comes from the right coronary artery. The way we're going to check that is to do
V4R.
V4R, another 12 lead, run it again. If we have elevation in this new lead called V4R, we are suspicious that yes, it's the right side for sure. You may also have some depression in the lateral leads. Okay. And then what about B? Why is B wrong?
Because, I mean, for a couple of reasons. So his heart rate is more bradycardic, and adenosine is a tachyarrhythmia medication.
Nice. Okay. So that's enough. And then what about the nitro again?
We won't give it because
Yeah,
he's
you already
hypotensive and
said no
because he's got a
nitro.
contraindication.
So in that case, we just kind of eliminate it down to the answer. And that's, you're going to use that strategy over and over and over. Just eliminate what's obviously wrong for any reason. Okay, let's go to the next one.